Yes. So good day, everyone. Good evening from Nigeria. I want to welcome you all to today's presentation that would be anchored by Dr. Noimot Abisola Balogun. A brief profile of Dr. Noimot. She is a public health translation strategist who is revolutionizing the healthcare narrative through human-centered engagement and public health relations. She has an undergraduate in dentistry, a master's in public health, and then transitioned into social sciences with a diploma in media and communication and a master's in mass communication. She is currently a PhD candidate in applied communication at the University of Lagos. Dr. Noimot Balogun has years of experience in health system public project translation with the following expertise: PR and health/campaigns promotion, science communication, demand generation, community engagement, and local human-centered designs for health innovation. Dr. Balogun works as a technical consultant to local and international health institutions, facilities, and donor organizations. Some of the organizations she has consulted for include Farm Access Foundation, Emergency Response Africa, UNDP, Nigerian Institute of Medical Research, Center for Clinical Trial and Implementation Science, and the Maternal and Reproductive Research Collective, MRHRC. In these capacities, she developed documentaries, explainer videos as science communication audio-visual teaching tools, developed jingles and skits as waiting room edutainment programs, and led the conduct of rapid surveys, community-based scoping, and qualitative research at local government, state and national levels. Internationally, she is a recipient of the Geneva Foundation of Medical Research Training on Reproductive Health, Research to Practice. She was one of the 52 research ambassadors selected for the $6.8 million Research Council to Lancaster University with capacity building engagement in the United Kingdom, Ghana, and Malawi. She has presented abstracts at conferences such as South African Public Health Conference, the Association of Public Health Physicians Conference, and the Academy of Communication in Healthcare Conference in California. As a professional interested in inclusion and diversity through global health equity, Dr. Noimot Balogun is a course facilitator at the Patrick Training Academy, where she teaches stakeholder communication in special needs therapy to school owners, educators, parents, and therapists. Please join me today to welcome Dr. Noimot Abisola Balogun as she presents the topic titled Science Communication in a World of Many Lenses, Between Influence and Impact. Thank you so much. Doctor, you have the floor.
All right, good evening, good afternoon, everyone, depending on where you are across the globe. Thank you so much for the citation. I feel honored to be here. And I am going to get right into the presentation. So I'm going to be sharing my screen now. Okay. 1 minute.
Yeah, so do let me know.
Can you see? Yes, all right, no problem. Can you see my screen now?
Yes, absolutely. We can see.
All right.
Yes.
Okay, so let me just go on to slideshow. Yeah, I just did so. All right. So science communication between influence and impact. Why do we think that this is necessary? So, well, based on what we know so far, the goal of scientific research is to describe, to explain, to predict, to control, and all in the bid to be able to contribute to the body of knowledge. Now, how do we then contribute to the body of knowledge? One of the things we know is the fact that when a scientist has been, based on curiosity, has been able to find out and made some discoveries, then he or she is saddled with the responsibility of translating or showing how this particular knowledge is going to, contribute to what we already have before. So that means that essentially, after the curiosity and the investigation, the next step is the interaction with people around and people afar. And essentially, it means that dissemination is one of the core areas of research or scientific research, because that is what then takes whatever it is that the scientists have found to the stakeholders. And as such, I thought of it that, okay, in just writing, like doing a snapshot of the value chain of science, we have the scientists here, we have the influencers, and we have the users. Now, I'm going to explain this one by one. Of course, the scientists are the curious people who, for whatever reason, thought of it, oh, why is this so? Why why does this revolve? Why does the earth revolve around the sun? Why do we have it this way? Why can't we have it that way? And by the time we're done, oh, somebody created the concept of electricity, and snap, you have electricity. Some people are going to use it. So we have the users. But then we have people who are influencers that would make the adoption of whatever has been investigated and found to get to the different users. And they can also facilitate the adoption by these users. And as such, this takes me to the audiences of scientific research. Of course, we have the specific audience, which usually in this part of our world, I'll be very happy to hear from Julie at the end of this program how it happens in US. But in this part of our world, we tend to have the research peers. We tend to have, the institution that the scientists would interact with. So let's say this is a medical scientific researcher. We're looking at the clinical department. But then we also have, especially for people who are doing grant-based research, we also have some other stakeholders in each of our institutions, like the admin, the account, the procurement, who would who would make case for the account amounts costed, who would make case for the equipment and the and the things that are going to be bought, the lab materials, the equipment, and all of the things that would allow the scientific research to be possible. And then we have the respondents who, let's say for a clinical trial, these are the people that we're going to be using and interacting with to be able to get evidence for whatever it is that we are bothered or we want to research about. Now, we then have the broad audience. Now, after the research has been done, we would have the local and global research community, which usually, is where people try to disseminate the research. So you have the publications, you have, abstract presentation, you have term paper publication. But somehow, for some people, research tends to stop here. But then we also know that we collected data from some people. There's a need for us to take data, the findings of whatever it is that we found, back to these people and their social circle, who are the people with similar characteristics or perspectives that can affect whatever it is that we must have found out. So we have the publics, then we have the policy groups. The policy groups, it could be people from the private sector, the public sector, the grassroots policy themselves. And then with the advent of social media and technology, we also have yet another popular group based on influence, which is the online community and by extension, the global community. Gone were the days where we thought of it that whatever it is that we did in Nigeria stayed in Nigeria. Hello, now something is done in Nigeria and in the twinkle of an eye, based on the the rapid kind of messenger exchange, you have somebody in the US or somebody in India getting the updates almost immediately. So we now have a global community, just one community globally. And as such, we could conveniently say that life has evolved. Life has evolved based on innovation, based on social media engagement. And as we move on, a number of these social media apps are beginning to get monetized. And as such, there's going to be a bit of clash between what we think as influence and what we actually will get as a matter of impact. We're going to be having a clash of because even demographically, life has evolved. Whatever it is I do now in Nigeria can easily be seen in Netherlands in just a twinkling of an eye. So life has evolved demographically. Attitudinally, we're beginning to have an increase in user experience dynamics. We're beginning to have more of eyewitnesses accounts. We're beginning to have, people who would just take the video and straight up, these people, whatever it is that is there is everywhere on Twitter, is everywhere on Instagram, is everywhere. So attitudinally, the publics or the users are beginning to see the power that they have with regards news item, with regards findings, whether or not it is verified, with regards the market forces when it comes to, oh, if this thing comes out as a news, it has the ability to even reduce stock in the stock exchange, places. So it means that attitudinally things are evolving. Environmentally, we're beginning to have more discussions around sustainability, around equity. So right now, we tend to have, more talk around interdisciplinary approach to work. We're beginning to have more discussive, approach to even surveys. That it's not just enough for you to take a quantitative survey. Just what if the perception of people would also add to whatever it is that you're inquiring about. So people, we're beginning to have much more community who are big on public good, who are big on social good, who are big on equity. And as such, it's not just going to be business as usual. Things are evolving. And because of that, scientists also need to evolve. 1 minute, please. Um, all right. So based on this, let me quickly go back. Okay. So based on this, we have, now that we know that a lot of things are evolving, including us as scientists, how do we then begin to build impact-based influence? How do we begin to have a kind of balance between influence and impact? How do we begin to have a bit of, not necessarily compromise, but one that leads to like a win-win between scientists and their different user groups? And so this means that there is a need for us to rethink our research process, to rethink our scientific processes, at some point in our lives. For some people, a number of the research that they would do is simply because of publication. Oh, I need to become a professor in my institution. Oh, I need this particular publication to be able to go to the next level. But then life has gone beyond that, because the respondent that you're going to be using are much more aware. The respondent that you're going to be using for your research, for your different inquiries, now understand the power of voice, now understand that their voices matter, now understand the power of public opinion through social media. So if they think of it that, oh, this thing that you used for us, you didn't explain it to us, and now we are reacting to it, it just takes a particular viral video of it on social media, and it brings a lot of questioning to one's scientific inquiry. So for this reason, there's a need for us to have a clarity of purpose. There's a need for us to build influence for retention and adoption. If one is going to build influence for retention and adoption, then it means that right from the beginning, even before the protocol stage or the protocol design for whatever scientific inquiry that we're making, there's a sense of who are the people that are my stakeholders? Who are the people whose influence will be useful in translating whatever this is to the different audiences. And as such, it's going to create a sense of unity right from the very start, knowing fully well that we now have a much more aware population, a much more, increasingly internet survey population that can ask about your research, or ask about your integrity, or ask about the quality of your scientific inquiry just by a click on their phone. So we then begin to look at more of an Ubuntu phenomenon, which looks at co-creation. How do we build together? How do we show a sense that this is for all of us? I win, you win. And so from the very beginning, we look at this as a this is for us by us. And of course, there's no way we can't be able to get all of this if we are not thinking of the, so who are the beneficiaries? Out of these beneficiaries, who are going to be the influencers that would push, this discussion and this narrative around and across the, beneficiaries? And it is good for us to get them in right from the beginning of the research. And this also then takes me to the connection. There's no way somebody's going to believe in me as a scientist who has a value to bring to the table, a value of impact, when we do not have the same connection. So I would need to ask, are we on the same page? How do I know that we're on the same page? If I'm a scientist and not even people around me, and when I mean people around me, I mean friends and families, have an idea of the things I do, why do I think that the public out there would have an idea of the things I do? So the influencers that I'm going to be using, do they have the same interests? Do they have the same goals? Do they have the same core values? And I'm going to take this one by one. When I mean interests, imagine, a Julie or Dr. Kemi, or Dr. Imelda doing something on a particular microbe. And this particular microbe is one that shows maybe the effect of a contamination, maybe an alcoholic contamination. This is me just giving a vague example. And then we are done with this discussion and we want to disseminate it. And we are using an influencer who earlier this year signed up to be an alcoholic brand ambassador. The interests will clash. There will be a clash of interest. This person already is an alcoholic brand ambassador. Whatever it is that you found in your research or your scientific approach is showing that this particular brand of alcohol do not have the right, efficacy or safety amount that is good for the population. So there's going to be a clash, a conflict of interest. So same with what goals are we looking at? If you want to use an influencer, and when I mean influencer, whether online or offline, what goals are they also looking at? Are they looking at a thing in terms of impact, or for them, it is about the monetary value or the status symbol? What core values do they have? Are the core values the one that goes on to kind of like corroborate the scientific inquiry that we've made or not? And this then takes me to the principle of inclusion. A number of times, I usually talk to some of my clients when I see them, when they want to do their research work and all of that. I mentioned that you need to be able to look at what you want to do, what you want to inquire about. So there was a time some people told me that they wanted to make an inquiry concerning maternal death. And they mentioned what's it called? They mentioned they had the concern of the challenge that they had in getting respondents to be part of the survey in the country that they're looking at. So I remembered when they asked me for my opinion, I mentioned to them, where are the countries that this has been done before? Those countries happen to be, developed countries. And I said, in a developed country, It may be easy for somebody to talk about death, or death of a spouse, death of a younger sister, death of a mom, due to, they're trying to check something on maternal mortality. I said, in a place like Africa, it may not be easy, where there is a lot of religionism and spirituality. They may not want to go back to start having discussion about a death that they've, over the time grieved and healed from. And as such, when you're looking at an inclusive discussion, you would look at the different perspectives and the different psychographic evaluations of the different audiences, and would make you, so if you are going to have to do it in Africa, instead of using the same sample population or sample size that you used in the developed countries, where a number of them will be willing to talk about these things, or may be willing to talk about this thing, you may want to use a smaller sample size in a place in Africa, and you would then put the reason, the justification for a smaller sample size based on their own psychographic, peculiarities. So it would make it easy for us to be able to connect. Secondly, we would also look at the need for appropriate message framing. If as a scientist, I'm finishing up this discussion and it is time for me to go to the respondent, and at the time, at the point of the respondent, I am, the first thing I need to do is to ensure that the respondents understand even my questionnaire. Sometimes when we want to talk to our respondents as scientists, we're even trying to explain what is there, even when we verbalize some of the questions in the questionnaire or the interview guide, some still struggle to understand it because the messages sometimes are somewhat too technical. So if you're talking to out of school, there was a time I did something for a research institute, and they said they wanted to gain perspectives on HIV, testing and all of that in out of school children. And I saw the questionnaire, and it was a 10-page questionnaire. And I remembered asking them, you just told me that you want to do something in amongst out of school children, and you're having a 10-page questionnaire. If they loved reading or loved listening so much, they won't be out of school. They will be inside school. So for you to want to engage them, a community, a form of what's it called, using emojis or using picture framing to be able to connect with them would maybe more appropriate, rather than having a full questionnaire paper that is 10 pages for children that are out of school, teenagers that ordinarily are distracted, and now to add to it, they're out of school children and it's 10 pages. I said they may not listen, they may not want to listen. And even when you force them to listen, they may be forced to give you very, very monosyllabic or bisyllabic responses. And as such, you're not going to have the robust, responses that would make you to be able to make informed, deductions from some of the analysis. So there's a need for us to be able to understand the audience, to be all inclusive in looking at the audience profile, and then to develop messages that suit the audience. So if you're going to be talking to elderly of like 65, 70 may not have the energy to answer a 10-page question, 10-page questionnaire. So you could want to look at, oh, is there any way we could use some bit of rating? Can we use some things of, they can just tick, they can just say yes or no, they can just look at the emojis to be able to answer the way they feel, rather than so long, messages that they have to think to be able to answer. Hello, I want to be sure that I want to be sure that we're on the same level. Can I continue? Can I continue?
Yes, sure, Dr. Noimot, we are with you.
All right, thank you. And so based on this also then determines the appropriate. So after we are done we've done the, engagement, we've done the data collection, we've taken it back for, if it is quantitative, for, analysis, and if it is, qualitative, for the transcription and the different categorization, and the coding before we analyze. Then we then realize that, okay, whatever it is that we've found, who are our beneficiaries that are expected to listen to this dissemination? So it's easy when we develop manuscripts. Of course, for manuscripts, we're still going to be talking to some of our scientific peers, who are also researchers and can connect. But by the time you want to get out of that research community or the scientific community, your communication channel and the framing of the messages should change. So if you're going to be doing a policy brief, your language shouldn't be that of totally scientific. I mean, it has to make sense to me as the senator, as the, governor of Maryland, as the mayor, before I can be able to make a sense of it in my cabinet. So by the time you're talking to me as a mayor, or you want to talk to me as the head of an establishment, if this person are people in government, you have to be able to discuss whatever scientific findings that you have in the form of impact. So you want to talk about the facts and figures, starting from what they used as their own manifestos. So what is the current government manifesto for health, for education, for antimicrobial resistance, for, all of this? And then what was it that your research is about? What did you find? How can these facts and figures then help the government to be able to improve the quality of life, to be able to improve the well-being, to be able to improve, national health outcomes, to be able to improve the productivity index, to be able to improve the human capital development? That is what a policy brief expects you to put. They don't want to know how you conducted the design of your study. You don't want to know whether, this was the way you took the data, the data collection and all of that. They just want to be able to say, based on the manifesto that you gave, this were the, 3-point agenda or the global goals. Based on this sustainable development goals, based on this is what I found, and this is how the findings can be useful to the beneficiaries or to the citizens. So it's essentially a citizen briefing from a political or a policy point of view. Now, if you now want to take this to the publics, and when I mean the publics or the people, the mass and all of that, you want to look at the jingles, you want to look at the skits, you want to look at animation. It may just be a documentary, that can then show how this started, what you did, what you found, and how it can change the course of life for good in the nearest future. So we can have that. If you want to, if what you have done is to be able to train other people that will become trainers for others. So let me give you an example. Imelda is working on antimicrobial resistance. And Imelda has found out that, for antimicrobial resistance, these drugs have been implicated in this. If she wants to train people in grassroots, and they are going to go through the primary health centers, then it means that she has to train the primary health centers, the primary healthcare workers. Now, the primary healthcare workers are not going to listen to animation. That's why they work in the PHCs. They interact with people in the communities. So what's going to happen is that you would have an explainer video that then explains the antimicrobial resistance in simple languages. Of course, they are educated, don't get me wrong, but they may not be so technical to understand you as a scientist. So you have to break it down, maybe using some bit of, infographics, to be able to explain to them on why this particular drugs or this particular practice would, make the issue of antimicrobial resistance to be worse, and what they should do and what they should tell patients when they come to their, health centers. That is why an explainer video is there. So when I see people use explainer video of foreigners and you are showing it to locals, I just smile. You are not communicating. Sometimes these people do not even, that's why they listen to and they watch local movies. Not everybody can listen to, a foreigner and they understand. The same way, if you want to also discuss with foreigners, you want to use the documentary rather, that explains some of these things in a little bit of maybe more technical way, but at least in a form of a story. So documentary is like a technical story that shows where you're coming from and where you're going to. But when you want to talk to the publics, you're looking at, jingles, explainer videos, the skits. And for the ones that are young, maybe teenagers or young children, want to teach children about antimicrobial resistance, you can use animation. So there's a need for us to be able to understand who our audiences are. You just do not develop animation because, hey, this is what I want to do. It's not about you. You already did the research. The dissemination is about the people that you want to disseminate to, the users that are going to adopt whatever it is that you found. It isn't about you anymore. And as such, we go back to the need for inclusion. For you to be inclusive, your message framing has to be appropriate. Your communication channels has to be tight. And the things that the way you're going to disseminate to them has to be clear. And then this then takes me to effective communication of science. Where do you belong? Do we want to have people share some of their experience? Where do you think you belong when it comes to effective communication of the scientific inquiry that you've done so far? Is there anybody that would want to share our insights? Imelda is smiling. You want to say something? Julie, would you like to say something?
I think Julie might have something to say, but maybe if we can wait till the end. I think all of us are really excited with the presentation, and
all right,
we'll have something to chip in.
Just remember the question. I've kind of, my brain started ticking.
Okay, so should I continue?
Yes, please.
All right, thank you. All right, so this is a food for thought for us. Where do we belong when it comes to science communication? So I just wanted to quickly mention the role of online influencers on, working with scientists to be able to get some of their things, sorted. On Facebook, I think about 3 months ago, there's a particular Facebook influencer. He has close to about 100,000 followers on Facebook. His name is Kelechi Deka. He has a PhD in social sciences, and he writes about climate, countries. He writes about languages, and essentially intellectual. He's an intellectual influencer. So there was a day that he said that he found out about, there was a particular topic on oral health and changing of toothbrushes. And he said that the research linked it to possible male reproductive organ malfunctions when people do not change their toothbrushes. Now, when a researcher, just an ordinary scientist, writes on a research finding online like this, you may just, kind of like find a way of having maybe just 10 likes or 20 likes. But because Kelechi Deka is an influencer, that particular, post, as at the last time that I checked, had close to about 100 shares, about 300 likes, and had thousands of reach. Now, I was just trying to do some bit of, content analysis on my own. And I saw that. I was just trying to think of it. What could be the reason why this particular post by Kelechi Deka went so viral? And I thought of it based on what I saw, based on the different responses and the way I was able to do the counting. I saw that there were four variables that came out so strongly. The first one was the influence of Kelechi Deka on Facebook. People trusted his judgments. It didn't matter whether the link, I'm not even too sure whether people clicked on the link to read the full research. What mattered to them was that Kelechi Deka said it, and as such, most likely it has to be true. The second that also came out strongly was the fact that it had a link to male virility. One of the things that I know about African men is that they are big on their reproductive function. So maybe some of the other people that showed, that commented, that showed a sense of concern, also had some bit of concern because of the reproductive organ that was, involved. The third part of it was the message framing. It came as, hello, see, changing your toothbrush can look simple, but guess what? If you do not change it, you may be toying with your male reproductive function. So the message was clear enough, and it was crafty to make people go, what? Wow, you mean it? Are you serious? And the last part of it is the fact that they probably thought of it that this thing that they're even asking us to do isn't something big. Is it just to change my toothbrush? I can buy a new toothbrush this night. Those were the four variables that came off strongly when I was trying to do the analysis of that particular post. And then this then goes on to say, when it comes to online engagement, there's a level of trust that would determine how much people would, believe in you. So it doesn't matter whether you are the best scientist in the world. When people it means that before scientists can be believed. Remember I said Kelechi Deka also has a PhD in social sciences. So we can also say it conveniently well that he's a scientist, right? But apart from that, he has built a brand on social media with his level of intellectualism. So a lot of times when people read something and they don't understand, especially when it comes to all of those social, archaeological discussions and all of that, they bring it to his wall and they ask him such questions because they know that somehow he knows about a number of these things. So because he has built that trust, it was easy for people to engage. In fact, a lot of people forgot that it was scientific research that he was talking about. So are we building this kind of trust in research through engagement? This is one question we need to ask as an association, graduate women in science, as individuals, as individual women scientists. And so this brings me to the conclusion that science communication can indeed be a salad of many colors and tastes based on the experience of the user. It can be candy, it can be vinegar, it can be mixed. And then I asked again, what experience of science communication are we living with our audience? Thank you so much. Over. Let me stop sharing.
I was supposed to be here today. This is like amazing. I was supposed to get home to this meeting today. I was supposed to hear you talk.
Wow.
It was meant to happen, but I had no idea. That was amazing.
Thank you so much.
And
Thank you so
much, the male virility has nothing to do with Nigeria. It's like
thank you so much.
Not restricted. So.
And for sorry, let me just quickly round up by this.
Okay.
And so this also brings me to even us seeing it here. You can see the number of people here. We have 6 people. I tell you, I kid you not, if we were going to have, if they said, oh, there's going to be a manuscript presentation or manuscript publication, manuscript writing, you would have 50 people here. Because a lot of time, the focus, the energy is on doing research, doing this, doing that. But then when we do all of this research, all of the many work that we're doing, I want to, and I stand to be corrected, that if this is not disseminated to the right users and they do not use it, these people are still going to go back to meet alternative sources away from us. So even right in the Graduate Women in Science Association, we have just 6 people for something that is supposed to be a global gathering. So it just says a lot about the way we even take science communication. We see it as an ad hoc. And when you see it as an ad hoc, you're going to put that same levity when you're developing your research. You would think about it as a last resort, if it is a resort at all. Thank you.
Wow. Thank you so much, Dr. Noimot, for that very brilliant presentation. In fact, the delivery was excellent. And I knew you were not going to fail me. I actually single-handedly sought you out because I know you're very good at what you do. And it's such a shame that, like you said, people do not really appreciate the role of science communication in all the science, in all the research that we do. But I do know, like you rightly said, that science is evolving and times are evolving too, and there is need for researchers, scientists to evolve as well in our knowledge dissemination approach, because we're so used to, oh, publish or perish. We are just publishing all these very wonderful findings, and they are all in the shelf or in some journals there where nobody really reads them. It's only out there for our fellow researchers and scientists to just go when they need to
And
synthesize
sites.
information. But the actual general populace, the common man on the street, the layman that needs to know these things, do not have access to them. And that's where science communication plays a role, because it makes it able for you to simplify it in such a way that the layman on the street can understand why they need to do what you're saying they should do. And also for the decision makers as well, understand us, because oftentimes, researchers and scientists, they lament that, policymakers and decision
Nobody's
makers
listening to
are
them.
not
The
listening,
corporates are not listening.
and they are
Yes.
not using their research findings. But then on the other flip side, the policymakers and decision makers are saying, you know what, you have all these findings that are not tailored in such a way that we can use it. We do not
Yeah.
understand what you are talking about. So
Yeah.
I think there has to be some balance and some trade-off
Yeah.
for us to
Yeah.
begin to work together, for the
Yeah.
greater good. So thank you so much, Dr. Balogun. And now
Yeah.
we have to open the floor for questions. I know we are all excited with the presentation and we have a lot to either chip in or as a suggestion or a question. I think this is the time to do that. Thank you once more, Doctor.
I guess. What's interesting for me is because I've been scientifically focused and I'm full professor now, and I'm supposed to go, I'm going to say out into the world, so to speak. In other words, less service and more outwards speaking, I guess. And so the original topic that I told you about, so you ask so many questions that put so many questions in my brain. I do have a contact person that someone put me in contact with that might be a good person. It's like, who's going to listen to me as a white woman who might be telling a story of the difficulties of a Black woman in a graduate science? Who's going to listen to me? So you ask a million questions that again, I was supposed to be here, that I need to think about, who's going to listen and who do I want to reach and how do I go about doing it? And every other thing that I wrote down, plus re-listening to your presentation will be really helpful. And someone did put me in contact with somebody who I haven't contacted yet, because I'm just in the process of thinking about the IRB and and having to fill out the form and blah, 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 and all that stuff. So, but having, and I'm experienced prejudice myself as a woman, it doesn't compare to a Black woman, I don't think, in science. And having spent 6 hours with a young Black male, talking to him about what I was concerned about and what kind of questions do you think I could ask. He was so wonderful and so helpful and talked about his experiences as being a Black person. And I can't, and just my own things, just, anyway, it's amazing. So you open up so many neurons in my brain, like going like this. And and I think you could probably be of great help to me, but I'm not quite there yet. But I think you could really help me. But I'm going to be I'm going to be into a webinar on Monday that's coming from American Chemical Society, and I don't know quite what the title is, but it goes along with what my interests are, and I want to listen to them, and I want to talk to JLM again, and kind of think about my thoughts, and then I have contact with somebody else. But I'm only just beginning, and just going through the IRB thing. I'm not going to ask for any identification, so it's going to be a shortened form, but I still have to go through the thing and write all my stuff. So just again, I was supposed to be here just because of what I want to do, and I want to make an impact. And who do I make it for, and who do I reach, and how do I reach them? And you've opened up all those questions. So it's just been it's a little overwhelming because I was already overwhelmed about the IRB, even though I can do it in a shortened form. But I still have to go through the process and so forth. And what are my questions going to be? But you just I'm not doing the science fair project where I'm solving the world's problems, as I tell my students, but I need to bring it in, and kind of where is that sweet spot. And I thank you. I mean, you haven't helped my brain. You just made it more noisy.
Thank you so much. And I think that thank you so much for, having to discuss some of these vulnerabilities. And I think that I think one of the things that we could also do, you teach students, and we should also have a way of stepping this down to these students. They are younger, and they are the younger generation, coming up, to be able to begin to think of these things, so that, like we said, we just need to begin to have scientists that are evolving. The situation that is going on in the world is not going to change. Now we are thinking of artificial learning, artificial intelligence, machine learning. So things are going to continue. And the earlier we understand that the world isn't waiting for us, the better we do better with citizen science. Citizen science has come to stay.
Right.
The public and population, they are increasingly becoming more aware. The earlier we understand that as scientists, the better for all of us. So I'll be very willing in one of your class to come share my thoughts and teach them virtually. I'll be very happy to do that for you.
Oh my God. Well, I teach chemistry, and most of the students are 18. I think I have somebody that goes up to age 27, but they know what my science research is. They can see my posters, but I'm switching, but I have not talked about what I'm switching to and why. So help more individually, but I'm not there yet to sit with you, and I don't want to just be talking. I want to be able to more clearly state, I know what I want to do. I feel the stories, and I want to call them stories. That's what I think they are. They're stories of, because I've met too many women of color, been to webinars where they're talking as graduate women and maybe now at a university level, and the challenges are, I think, unacceptable. That's how I feel about it. But it's a reality. And this year I have more Black students in my class than I've had before, and I think it's because
hello, Julie. Sorry to interject. I'm just going to stop the recording so that we can continue.
Well, good. Thank you.
But don't worry. Maybe I can also edit out some of the ending parts, because you were talking about your school. You might not want that. That was.
Yeah, nobody needs to hear that. But I think because of the time I